Hi, my name is Maria Perez and I'm an occupational therapy student at Texas Women's University. Today we will be conducting a hand examination. So the first thing you want to do during a hand examination is you want to observe the upper extremities of the patient. You want to look at the color of the skin to see if there's any redness or any bruising. You also want to check for the temperature to make sure it's appropriate. And you want to observe for any potential swelling at the different joints. After you are done observing, you want to check the radial pulse right here. You also want to check the ulnar pulse right here. And lastly, you want to check the brachial pulse right about here. Okay, so then you may proceed. So the next thing you want to do is check the capillary beds. You also want to make sure the patient is not wearing any colorful nail polish like this. So for this purpose, we're going to use my nail beds. So you want to press at the nail bed and you want to make sure that the capillary refill is about 2 seconds. So you press for about 1 second and you just want to check that the refill comes right back in about 2 seconds. Okay, and after you are done with the capillary refill, you want to perform range of motion on the upper extremities. Okay, now we're ready to do range of motion of the upper extremities. So the first thing you want to do is you want to make sure that the patient can touch their thumb to their ipsilateral shoulder. And you want to do the same for both shoulders. Okay, now with both shoulders tucked in, like so, you want to be able to rotate the forearm into pronation and supination. So we want to do that for pronation and supination. And you want to do the same for both arms. Supination and pronation. You also want to make sure that they are symmetric. With the elbows on the table now, you want to check for wrist flexion and extension. Wrist flexion and wrist extension. And you want to make sure you do that to both arms. Wrist flexion and extension. Okay, after you have completed wrist flexion and extension, if there is a problem, you would expect limited range of motion. Another thing you want to check for is digit motion. So at this point, you want to flex the fingers all the way up and all the way down to the palmar crease. Like this. So you want to make sure that their digits can flex all the way down and they can extend all the way up. And again, you want to make sure you do this to both arms. Okay, so flex fingers all the way to the palmar crease and extend all the way up. The thumb should be able to flex all the way to the 5th metacarpal. So for this purpose, I went ahead and drew the 5th metacarpal right here. So you want to have the thumb touching that area, like this. Okay, and you want to make sure again you do that to both hands. So touch the opposite side. Okay.